Hey guys, here's a picture that I draw for all my patients to explain what a concussion actually is. I figured that this would be good for all of you to understand. First off, here is a brain cell. It's not a very good drawing of one, but it's a brain cell nonetheless. You have a cell body, and then you have these long tails called axons. Inside of a brain cell, you have a bunch of molecules. On the outside of a brain cell, you have a bunch of different molecules. When a signal comes in from one brain cell to another, there's little channels that will open on that brain cell. When those channels open, the stuff that's inside escapes outwards and the stuff that's outside comes rushing in. So there's this exchange that happens, and it makes this brain cell excited. When that brain cell gets excited, it passes that signal on to the brain cells that are connected to it. So you have brain cells here and here and here, and they'll pass that signal on because their stuff will exchange, they'll get excited, and they'll continue that process. So this is how communication happens within the cells of your brain. Now, when a concussion happens, we used to think it was the brain hitting the inside of the skull, creating kind of a bruising on the outer part of the brain. That's not exactly what happens. What we now know of concussion, or at least what the current hypothesis of concussion is that the brain actually gets stretched. So if we think of the brain as jello, and if I was to shake a plate of jello, it's going to deform up this way and it's going to deform up that way. And if I was to zoom in on every little jello fiber strand, we would see each of those strands getting stretched. And it would kind of deform up this way, and then it would deform up that way, and you can picture this jello jiggling back and forth and getting stretched. The brain is actually the same consistency as that. So when the brain gets hit and it starts to jiggle back and forth like that, you get this stretching of the brain tissue. When that stretch occurs, these little channels get pulled open, the stuff that's inside escapes and the stuff that's outside comes in. So what's going to happen? Well, the brain's going to think that it's received a signal, and it's going to fire, and it's going to pass that signal all to the next brain cells. So all a concussion is not a bruising of the brain as it smashes into the inside of the skull, but actually it's millions of brain cells all at the same time that get tricked into thinking that they've just received a signal. And so you get this electrical storm that starts to happen, and then it kind of calms down. So the first part of concussion is called the excitatory phase. This is when all those brain cells are firing and getting excited because they think that they've received a signal. Then, this is what happens. The energy molecule in our brains is called ATP. This down here represents time. All of that brain cell firing that happens in that initial little part of the concussion is a very short duration thing. But what it does is it burns a lot of energy. So over the next few hours to days, your energy stores start to plummet. Okay, you hit your peak low, and then you start to rebuild those energy stores back up until you're back up to here, and then you're kind of fully recovered from that concussion injury. Okay, with a concussion, you only get about a 20% reduction in your ATP. When you look at more severe forms of brain injury, like moderate and severe traumatic brain injury, you can get as much as 50% reduction in your ATP to the point where you actually get permanent damage of brain tissue. With concussion, there's no observable damage to brain tissue, which is why MRIs and CT scans are normal. But you get about a 20% reduction in this energy, this ATP level. You hit your peak low around day 5 to day 7. And then you kind of slowly start regaining back up. Now, the studies that have been done on this have found that the full kind of metabolic recovery happens at some point between 22 and 45 days, depending on the study that you see. So concussion has two phases. The first phase is excitatory. This phase is called spreading depression, where you drop in energy, and anyone who's been around anybody with concussion is going to notice that they feel very fatigued, they're going to want to go to sleep, and their symptoms will get worse and worse and worse and worse over those few days, and then eventually they'll start feeling better. Most people's symptoms go away around day 7 to day 10. That's the majority of people. But in about 30% of people, they're going to have symptoms even beyond this time point, and that's what's called post-concussion syndrome, PCS, or what's now known as just persistent concussion symptoms. getting back into this pathophysiological process here, this low energy, this is actually the dangerous point for concussion. Because even though the symptoms go away here, a lot of people go back and try to play their sports. Well, studies on animals show that if you get a concussion here, well, now you drop way, way, way down again, and you get this additive effect. So now you're getting accumulation of these concussion injuries, which can now start to result in potentially permanent damage, but also a very prolonged outcome. So after one concussion, which takes 22 to 45 days potentially to get this thing back, could end up taking up to 90 to 120 days for that ATP level to get back up to a healthy range. Now, what happens if you get concussed here? Well, potentially you're down here again. So the big thing with concussion is we want to make sure we get people to this point so that if they do get another concussion, we're potentially avoiding some of that cumulative effect and we just get a secondary concussion. Now, from this picture, I'm going to go in and start talking about post-concussion syndrome. Post-concussion syndrome. So we said that this process takes about 22 to 45 days. Now, people will come in often and they're 6 months away. They had their concussion 6 months ago and they're still symptomatic. Well, why is that? If this process is a very short duration piece, why are they still having symptoms? Well, there's 5 main causes of persistent concussion symptoms. Number 1 is blood flow. So after a concussion, aside from all of this that happens, there's also a significant reduction in blood flow to the brain. Studies on animals have found that as much as 50% reduction in blood flow to your brain. Most people, that will recover in the first 10 to 14 days. But in patients, particularly those with persistent symptoms, this can linger. And so what we do for that is we put them on the treadmill and we assess what their physiologic capacity is. This is also affected by their sympathetic parasympathetic nervous system. So this one is often called physiologic PCS because it's a dysfunction in how the brain is working. Number 2 is metabolic, inflammatory, and a new one, which is hormonal. Okay, a lot of this stuff is potentially dietary related. So after a concussion, you're going to have inflammation, for example. Inflammation can bring on other inflammation. You get this cyclical pro-inflammatory response. This can be affected either with anti-inflammatory medications or what I prefer to use is dietary interventions, trying to go on to a bit more of a low inflammatory diet. Hormones, this is kind of a newer one as it's not been studied that much in concussion, but more severe forms of brain injury have found that hormone imbalances are present. And so with concussion, particularly those that have really long-standing symptoms, hormones can definitely be playing a factor. Number 3 is the visual system or the vestibular system. Now I put those together because they often work together. So people might feel off balance, they might feel dizzy, they might feel they have this visual perceptive issue, they might have trouble reading even some cognitive problems where people can't concentrate or focus, sometimes maybe due to a visual problem, but oftentimes visual problems also include the vestibular system and vice versa. Vestibular problems include the visual system, and then they also include the neck. So with a concussion happens around 70 to 120 Gs of acceleration. So there's a tremendous amount of force that happens, right? And there's also a rotational component in this, around 5,500 rads per second squared, but that's getting a little bit technical. Whiplash injuries or injury to the neck happens at only 4.5 Gs. Previous studies have found that everyone who gets a concussion also exhibits whiplash signs and symptoms. And the signs and symptoms of each condition are so similar that you actually can't tell them apart. So what was a concussion may now be just the lingering effects of the whiplash that may have been suffered at the same time. So the neck also integrates heavily with the visual and vestibular system, where a lot of times visual dysfunctions will be heightened if you include the neck. For example, if I get you to turn your neck and I run a visual test, it will be it'll be significantly worse if I was just to do it straight on. So incorporating some element of neck function allows you to kind of tackle this whole thing. I usually will test these things together. Number 5 on this is the psychological. Okay? There's a huge overlap between things like post-traumatic stress disorder, anxiety disorders, depression, etc., where the symptoms look very much like that of concussion. It's also well known that people that have pre-existing anxiety, depression issues will go on to have longer standing symptoms in general. And so this type of overlay, which a lot of times it's the misattribution of symptoms, where people believe that their memory isn't that sharp and think that they're impaired, and so it kind of manifests every day in that type of kind of self-fulfilling prophecy, where if you start really looking for things, they start to appear. But also just the overlay of other mental health conditions can look a lot like concussion. So this one is definitely involved as well. So when it comes to concussion itself, the big thing is avoiding any type of subsequent injury that may drop your energy levels lower and create some permanency to the condition, or at least an additive or cumulative effect and a longer recovery. When it comes to symptoms that have been ongoing, basically once you hit the 10 to 14 day mark, we start looking at you as if you are already PCS, even though technically you're not until about day 30. So we start checking out blood flow, we start looking at this, we start looking at this, we start looking at this, and try to find out where your symptoms are coming from. Once we find out where the symptoms are coming from, well then it's treatable, okay? So, essentially that is what a concussion is, both in the acute and chronic phases. I hope that explained it well.